Hi, this is Keith, the Director of Software Support at Sage Applications. This video is a user guide for students who will be using the Sage Educational Electronic Medical Record System. This video is split into sections for ease of reference. Use the timestamps on screen to jump to the listed section. First thing we will need to do is log in to the system. For the purposes of this demonstration, we are using our Sage development server. Login at your institution will look somewhat different depending upon the email system that your institution uses. At most schools, your login information will match your institutional email and the password that you use to log in to your student accounts. After we log in, we arrive at the student dashboard. The sidebar on the left is collapsible using this button, the three lines in the upper left corner. In the upper right corner, you can click the moon icon to switch your view to dark mode. On the left sidebar, there is a quick link back to your dashboard and quick links to each of the courses you are currently enrolled in. On the left sidebar below your courses, you can see the calendar icon. Clicking here will open your calendar, which will show you open and due dates for all of your assignments. The logout button is at the bottom of the left sidebar. The first thing we see on the dashboard is a list of active assignments. These are assignments that are open and the due date has not passed. Below that, we see a list of all registered courses you are currently enrolled in. And below that, a list of all prior courses that you have completed. Now we're going to take a look at our course entitled Demo Course. Let's click on the View Course button to open it. In the first section, we have a list of case studies that are available for you to view, but do not have any coursework assigned to. Your instructor might assign a view-only case so you can follow along in the patient's medical record while they talk about the case study in lecture. We will open this case study and look at it in the next section of the video when we review how to use the electronic medical record. In the second section, we can see that we have two currently listed assignments. The assignment titled Week 1 was due last week, and it looks like our instructor has graded it already. We can click the View icon to look at our grades for that assignment. Week 2 is due today. If we click the Launch icon, we can open this case. When you open a view-only chart, the first thing you will see is a brief blurb about the patient case. This blurb is meant to orient you as to what is happening with the patient at the time of the case study. This patient, Long Vien, is a 7-year-old who has come to the clinic for asthma management. He was seen in the emergency department 2 weeks ago for an asthma exacerbation, according to the blurb, so we should remember that and make sure we review his emergency visit. Click Continue to enter the chart. Note that each institution can customize the EMR to their needs, so some information may be presented differently or use a different layout from our standard settings. On the top bar, you will see a picture of the patient and vital information about them: name, date of birth, medical record number, and any information restrictions for the patient are listed here. Information restrictions will list people the patient has instructed their care team to not discuss any information with. The allergy list is in the next box. In the third box, we see a list of the patient's current providers. This patient is an outpatient, so the only current provider listed is primary care. Patients who are hospitalized may have many more providers listed here. On the left side of the screen, we see the navigation bar, and we are currently viewing the patient's dashboard. The patient dashboard is customized to each institution and user type. The dashboard shown on screen is the clinic provider dashboard, which includes the patient's demographic information, active diagnoses, current medications, reason for visit, history, immunizations, and allergies. If you are a nursing student, your dashboard may include different items such as due and overdue medications, most recent vital signs, and a list of nursing orders. Going back to the navigation bar, if we click on Prior Encounters, we can find the notes written from the patient's previous visits within the system. We can see this patient has an emergency department visit from 2 weeks ago. Let's click on it to open it. In this view, we can read the patient's note and see what happened during his emergency department visit. We can click the title again to close the note. Likewise, we can click any other note's title to open the note and read through it. The Scanned Documents tab includes any documents that might need to be scanned into the system, like consent forms or release forms to disclose health information. For example, if a patient needs a blood transfusion, you would want to check the Scanned Documents section to see if there is a signed transfusion consent form on file. The Procedure tab is similar to the Encounter Notes tab in concept, but is specific to procedures performed. If you needed to review documentation from a past surgical procedure, this is where you could find the procedure note. This patient has never had a procedure done, so his is empty. The Medications tab is for medications that are to be administered during this encounter. This patient does not have any medications ordered currently. We will review medication administration in a later chapter of this video. The Notes tab refers to notes written during the current encounter. This patient has a note that has been partially written but is not yet signed by the pediatrician. We can tell the note is not complete because the title says pended. Let's open it and take a look. This note is a standard SOAP note with the patient's history and physical exam findings, but the assessment and plan is empty. This area of the chart is particularly helpful for assignments because incomplete notes often give us history and assessment information. Under Diagnostics, there are 3 categories: laboratory, imaging, and cardiac. Laboratory refers to specimens that are sent to the laboratory, such as blood, urine, or sputum. Laboratory findings are organized chronologically in the EMR. Imaging refers primarily to radiology findings. X-rays, CT scans, MRIs, and ultrasound findings will be documented in note form here. Just like in previous sections with notes, you can open the note by clicking on the title. Cardiac is where electrocardiograms, or EKGs, can be found. Click on the EKG title to open the image. For the student edition of the EMR, EKG interpretations have been omitted to encourage students to learn to read their EKGs. Under flowsheets, there are 4 major components: vital signs, nursing assessment, patient safety, and IO devices wound care. Vital signs includes all documented vital signs in chronological order. You can document vital signs here as well. Let's try it by typing 98.8 into the temperature row and clicking Sign. Vital signs include temperatures, heart rate, blood pressure, weight, and cardiac rhythm interpretation. Moving to the Nursing Assessments tab, here you can find documentation of physical assessment findings categorized by body system. Click the category to open the body system. Some categories have drop-down menus like level of consciousness. Other categories support numeric or free text entry like pupil size. Let's document a level of consciousness and the right pupil size, and then sign them to commit them to documentation. The Patient Safety tab is where nursing staff would document their hourly patient rounding, change of shift handoff reporting, and restraints. Just like in nursing assessment, some boxes are drop-down menus, where others support free text. This time we will document that the change of shift report was given, and that we have given a handoff to Nurse J. Click Sign to commit them to documentation. Next, IO devices wound care. Here we can document intake and output, devices like ostomies and urinary catheters, vascular access, and wounds. Let's document a peripheral IV that we just placed in this patient. Select the correct date and time of placement in the first 2 boxes. Then select the location, laterality, and site assessment findings in the next 4 drop-down boxes. Commit these to documentation by clicking Sign at the top of the screen. Now let's say we wanted to change the dressing on this IV. Select the location and laterality, and then we will enter a dressing change date and time. Then we will commit by clicking Sign. Finally, the Orders tab allows you to place orders for the patient. He doesn't have any active orders right now, so let's order an albuterol inhaler dose for this patient to be given in the clinic right now. Type albuterol into the order search and choose the albuterol option, then press Enter. Select MDI inhaled for route, once for dose frequency, and scheduled for schedule. We want to give this patient the 90 microgram per puff dose to start today and now for just 1 dose. Adding an end date is helpful for medications that need to stop on a specific date. For example, if you had a patient who needs an antibiotic every 8 hours for 5 days, you could either limit the number of doses to 15 by entering 15 for the number of doses, or you could enter an end date and end time that you want the recurring medication schedule to stop. Instructions are for medications that require specific instructions. Let's add a medication that requires one to try it. We will order a PRN 25 mg dose of atenolol to this patient's chart, just like we did last time, and add instructions to hold for a heart rate of less than 60. Now let's click Sign Orders to commit the orders. Now the orders we just placed are in the Active Orders side of the Orders screen. The active side of the screen will display all active orders. Some case studies will have a list of currently active orders already populated in this area. Just like a real patient's chart, some of those orders may be your responsibility as a student, so make sure you review the orders placed on each patient. To launch an assignment, click the Launch Assignment button to start. On the next screen, you will see a brief blurb about each of the patient case studies you have been assigned to. This assignment has 2 cases, Jie Li Wang and James Allen. The text underneath the patient's picture tells us a little bit about the patient. Here, the items indicator tells you how many questions have been assigned for each case study. We'll start with Jie Li. Click on View Case Study to open. When we open a patient chart, the system reminds us how to use the assignment navigation bar. The clipboard icon will open the questions that have been assigned. The button next to it with the 3 lines in diagonal formation allows us to switch between case studies within the same assignment. So if I want to jump from this chart to James Allen's, this button will allow us to do that. In the upper right-hand corner, the timer will display the time limit for the current assignment. This assignment does not have a time limit. If there was one, the timer would be counting down. In the previous section of the video, we went through how to navigate the EMR. So now let's focus on our questions. Click on the green clipboard icon to open the first question. Our first question is a multiple choice question. Multiple choice questions can be as simple as the one you are shown or may be much more complex. Most of the questions you'll be asked will reference the patient's documentation. If you need to reference the patient's chart before answering the question, you can click on the green clipboard icon again to hide the questions, navigate the chart as normal, and then click on the clipboard icon again to reopen the questions. Once we reopen the questions, we can see that our previously entered answer has been saved. If we wanted to change our answer now, we could do that as well. Click on the right-facing arrow to move to the next question. Question 2 is another multiple choice question. Let's select answer C and move on to the third. The third question is a special type called an order question. This question is asking you to input something into the EMR. Your instructor will be able to audit the chart to see if we have done this in the EMR. Just like the previous answer, any orders or documentation you enter in the chart will be saved for your instructor to review when they grade your work. Let's close the question and put in an order for a left finger X-ray. Navigate to the Orders section. In the search field, type XR. For location, we will enter fingers, laterality left, one view, timing, stat. Under reasons for order, you would normally input the medically relevant information. Here, I'm just going to enter question 3. Then we click Sign Order, and we can see that the order populates under the Active Orders section. Now that we've completed all 3 questions for this chart, let's jump to the next. Click this button next to the clipboard icon to switch charts. After selecting James's case study, let's click on the clipboard to look at the assigned questions. The first question is multiple choice again. Select answer C and click Next. Question 2 is an example of a long form question. Long answer questions can require quite a bit of writing so that you can explain your reasoning for your answer. After completing the question, we will click Next. The third question is very similar to the order question we saw in the previous patient's chart. This question has asked you to administer the patient's ordered ondansetron. Let's close the questions and go over to the patient's medication tab in the EMR. We can see the patient does not have any medications ordered under the Scheduled tab. Let's make sure this patient has ondansetron ordered by clicking the Orders tab and looking for it. We can see in the Active Orders section that this patient has an order for a CT scan without contrast and for ondansetron. Let's open the order to check and see why it wasn't under the Scheduled tab in Medications. Here we can see that the medication was ordered, but not scheduled. As you can see, all the order details for this medication are viewable in the Orders section of the EMR. Let's place a new order for the ondansetron anyway, but let's make it scheduled this time. Then, let's click back to the Medication section to administer our medication. Now under Scheduled Medications, we can see the new order we placed. If we scroll over, we can see the timestamp for the medication. It's currently past 11:30, so the medication is showing as overdue. Let's administer it now. There are two ways to administer medications in our system. If you are in a setting like the simulation lab, you might be given a barcode scanner. To administer a medication, you would need to scan the barcode on the patient's wristband and then scan the barcode on the medication label. When both barcodes are scanned, a prompt will appear to allow you to administer the medication. For this demonstration, we are going to administer the medication manually by clicking on the Overdue 11:30 text. The prompt you see here looks very similar to the prompt you would see if you used the barcode scanner. The only difference is that when you administer a medication without scanning the barcodes, you must verify at least 2 patient identifiers before you can sign the medication administration. The sign button is grayed out and will not allow you to click until having verified the patient identifiers. After verifying the patient's name, James Allen, and his birth date, 9/24/1948, the Sign button becomes available. The drop-down menu for status allows you to mark the medication in several different ways. Your institution will determine all of the different types of medication statuses. Under some scenarios, you may need to mark medications as an alternate status, such as held or refused. We will leave this medication as given because we plan to administer this medication, and then click Sign. Now this medication status has changed from overdue to given on the medication administration record. When we turn in our assignment, our instructor will see that we gave some ondansetron, just like the assignment asked us to. Now we can close the tab that the EMR is open in and return to our assignment page. Click the back arrow on the browser to return to our course page, or click the course name on the dashboard. Now we can see that we have completed 6 out of 6 assignment items, so our assignment is complete. We do not need to click a Submit or Turn In button, and if desired, we could return to the assignment to change our answers up until the due date. Now let's check our grades from the assignment we turned in last week. Click the spyglass to open our graded assignment in Past Assignments. Here we can see that we got the first question correct and the second question wrong. Questions that were not answered correctly will display rationale for the question if a rationale has been entered by your instructor. Question 3 is a free text answer, and question 4 was an order audit question. If we click the down arrow on the Student Order button, we can view all the orders we put in for this patient. Some order audit questions may have more than one potential correct answer or require multiple answers for full credit, depending upon what your instructor has asked you to do.